Hello and good day everyone. We are the Group 1 and we are tasked to deliver to you the lesson about medical devices which are ophthalmic, otic drops, and nasal spray. And also to describe the ultimate function and benefits of a new device named paclitaxel eluting coronary stent system. For the outline of our discussion, we will be talking about the name and illustration of each device, its brief description which includes illustrative parts and definitive function of each, and also the application of device, the stepwise manner of actual use, condition information, and patient counseling, and also we will be describing the ultimate function and benefits of paclitaxel eluting coronary stent system. After this discussion, you are expected to identify and describe medical devices found and used in pharmacy, present a systematic way of introducing and reiterating the proper use of some medical devices, provide relevant information to patients to ensure that therapeutic goals are optimized through these medical devices, and also to facilitate the introduction of new pharmaceutical medical devices or interventions. The first medical device that we will be discussing is ophthalmic, specifically ophthalmic drops. Ophthalmic drops are saline-containing drops used as an ocular route to administer. Ophthalmic drops are medicine that you put directly in your eyes one drop at a time. An ophthalmic drop is composed of three parts. First is the dropper, which assists in the delivery of the medication. It is where the medication or the solution comes out. It allows you to dispense the medication in a controlled manner. Next is the cap. The cap serves as a closure to prevent spills and evaporation. It also prevents the dropper from contamination. And lastly is the bottle or the container, which holds the solution and it is maybe or in direct contact with the solution. Eye drops are used to treat many common conditions. Some of the applications of an ophthalmic drops would be for viral or bacterial infections such as conjunctivitis and ulcers of the cornea. If you do not know what conjunctivitis is, well, conjunctivitis is also known as pink eye. It is a very common condition that causes inflammation, swelling, and redness of the membranes inside the eyes, followed by the accumulation of a clear or white, yellow, or greenish gooey liquid in the eye. Ophthalmic drops are very useful in clearing up on this type of condition. Next is for the conditions such as glaucoma. People with glaucoma have optic nerve damage from fluid buildup in the eye. If left untreated, this eye pressure can permanently affect vision. Glaucoma is the second leading cause of blindness in the world. Treatments include ophthalmic drops, which can slow down vision loss and save your sight. Next is the Rouette contact lenses. Rouetting drops lubricate your eye and hydrate contact lens, making your eyes more comfortable while wearing lenses. And lastly, to soothe dry eyes. Even more so now that the mode of learning is online and we always look at the bright screens.
This is the proper usage of ophthalmic drops. Before handling any medication, make sure to wash your hands to avoid contamination. Remove the over cup and turn the bottle over so the dropper tip points down. Prime the system before first use. Place 2 fingers on the base and your thumb on the shoulder of the bottle. Press firmly on the base and release. Repeat this several times until the first drop is released. Now the bottle is primed and ready for use. Lean your head back slightly. Gently pull down your lower eyelid. Hold the dropper directly over your eye and press firmly and quickly on the base of the bottle. This enables the bottle to release one single drop into the eye. Repeat for the other eye as directed. After each application, look downward and close your eyes slowly to allow the fluid to spread evenly over the eye surface. Place one finger at the corner of your eye and apply gentle pressure. This will prevent the medication from draining out. It will be a little bit uncomfortable, but try not to blink and do not rub your eye. Ensure that the dropper tip is dry. Replace the overcup. Avoid any contact between the tip of the bottle and your eye or your skin.
Ophthalmic drops. Hylogel in more severe and persistent dry eye sensation. It belongs to a class of medications called non-steroidal anti-inflammatory or your NSAID. It contains sodium hyaluronate in its eye drop, gel form, and injection. Hylogel do's and don'ts. Do's should be used according to personal feeling and or instructions given by the eye doctor. Instill 1 drop of hylogel 3 times a day into each eye. Take care that the dropper doesn't touch your eye, your fingers, or any other surface, because this could contaminate the drops left in the bottle. Store in a cool, dry place away from direct heat and light. Don'ts should not be used if patient has hypersensitivity to one of the ingredients. Do not double up the number of drops you use to make up for forgetting to use them. Do not wear soft contact lenses while you are using the drops unless your doctor or pharmacist has advised you otherwise. For additional information, Hylogel eye drops 10 ml help relieve mild to moderate pain, swelling, and joint stiffness in the knee caused by osteoarthritis. Besides this, Hylogel eye drops 10 ml also provides relief in dry eyes or irritation by providing lubrication while eyeing movement.
Our next medical device would be Otic drops. Otic drops are liquid medicine that you put in your ear 1 drop at a time to treat an ear infection. An Otic drop is composed of 3 parts, same as ophthalmic drop. First is the dropper, which will assist you to deliver the medication. It is where the medication or the solution comes out. It allows you to regulate the liquid coming out when instilling it in your ears. Next is the cap. The cap prevents spillage and evaporation and also prevents contamination. Lastly is the bottle or the container, which contains the solution and is perhaps in close touch with it. Some of the applications of an ophthalmic drops includes treating ear infection. It is also used to relieve pain, congestion, and swelling caused by the middle ear inflammation. And it can also be used for the removal of earwax.
This is the proper usage of Otic drops. Before handling any medication, make sure to wash your hands to avoid contamination. Warm the ear drops by holding the bottle in your hand for 1 to 2 minutes. This can help reduce any discomfort that could be caused by cold drops in your ear. If instructed by the physician or pharmacist, gently shake the bottle for 10 seconds. Remove the cap from the bottle. Place the cap of the bottle on a clean and dry surface. If the Otic drop has a dropper, proceed to the next steps. Position the head so that the ear faces upward. If you're giving the drops to yourself, it may be easiest to sit or stand upright and tilt your head to the side. If you're giving the drops to someone else, it may be easiest if the person tilts their head or lies down on their side. If the bottle has a dropper, draw some liquid into the dropper. If the bottle has a dropper tip, you'll just need to turn the bottle upside down. For adults, gently pull the upper ear up and back. For children, gently pull the lower ear down and back. Squeeze the correct number of drops into the ear. Your doctor's instructions or the bottle's label will tell you how many drops to use. Gently pull the earlobe up and down to allow the drops to run into the ear. Keep the head tilted for about 2 to 5 minutes so that the drops can spread into the ear. Wipe away any extra liquid with a tissue or clean cloth. Put the cup back on the bottle or put the dropper back to the bottle.
Otic drop or eardrop. Do's and don'ts. Do's: do proper hygiene in order to prevent infection and impacted earwax. Use wax softening eardrops available over the counter at the pharmacy in order for you to easily remove your earwax. Last, do know when you need to see ENT specialist to avoid a more serious infection caused by neglect. For don'ts, don't use a dropper that is cracked, chipped, or dirty. Next, don't allow the dropper tip to touch your ear, fingers, or any other surface. It could pick up bacteria or other germs that can lead to an ear infection. Next is, don't warm the drops under hot water. They may become too hot and hurt your ear. Next is, don't share your eardrops with anyone else. Sharing eardrops could spread germs and infection. So there is a precaution you have to consider in using Otic drops. First, tell your doctor or pharmacist if you have allergic to acetic acid or if you have any other allergies before using it. Inactive ingredients in this product may cause allergic reaction or other problems. Second, this medication should be used only when clearly necessary during pregnancy or breastfeeding. Consult your doctor about the risks and benefits. For additional information, always follow directions carefully. Do not miss doses. Store medications out of reach of children.
Our last medical device that we will be discussing is about nasal spray. Nasal sprays are liquid medicines you spray into your nose. Here are the parts of a nasal spray. First is the cap, and the cap serves as a protective cover on the device and protects the nozzle or the actuator from microbial contamination. Second is the nozzle or actuator. It is a button that the user presses to break apart the liquid formulation or a drug into a spray pattern. Third is the pump assembly. It permits expulsion of the contents of the bottle in the proper amount or dose. Next is the spring. Spring holds the pump assembly in place and is the mechanism by which the actuator retracts when pressure is released, returning the pump to closed position. Next is the dip tube, where it brings the formulation from the container to the pump. Lastly, the bottle. The bottle is the one that holds the drug formulation. Some of the applications of a nasal sprays include helping to wash out viruses, allergens, and irritants in the nose. Thus, nasal sprays are often used to treat symptoms of allergies and colds such as congestion, sneezing, and runny nose. But they can be also used for other purposes, like it can help to clean and hydrate nasal tissues, which is important for the maintenance of nasal immunity.
This is the proper usage of nasal spray. Blow your nose to clear nostrils. If instructed by the doctor or a pharmacist, shake the bottle gently. If your spray needs to be primed, spray it into the air, away from your face a few times before using. Tilt your head forward slightly. Do not tilt the head back. Hold the bottle with your forefinger and middle finger on either side of the nozzle and your thumb underneath the bottle. Close one nostril with the finger. Place spray pump tip 1/4 to 1/2 inch into your other nostril. Do not spray directly onto the nasal septum. Keeping bottle upright, pump once firmly. As you spray, breathe in gently through the treated nostril. Repeat the steps with your other nostril. Wipe off tip with clean tissue. Wait for a few minutes to blow your nose after using the nasal spray. Replace the dust cup if necessary.
Nasal sprays are often used to treat symptoms of allergies, runny nose, congestion, sneezing, and colds. Do's and don'ts of nasal spray. Wash the canister once a week before using. Nasal spray is good for 2 weeks of application. Keep your nasal spray away from children, window, and sunlight, and then store in a room temperature. For the don'ts, do not blow your nose for 20 to 30 minutes after spray. Do not put in sunlight. Do not spray down the back of your throat. Do not use if you experience nose stings and nosebleed. Do not share your nasal spray to other people, and do not waste your nasal spray. Application of nasal spray. Before using, make sure that you can sniff air through nostril before spraying. If not, it will waste the medicine, then it will cause irritation of your nose. When using nasal spray consistently and regularly, it will work effectively. Precautions of nasal spray. Avoid spraying the nasal spray into your eyes to avoid irritation. Make sure the water will not get inside the container. Replace the cap after use. Then always rinse the spray before using.
Paclitaxel eluting coronary stent system consists of a balloon expandable Veriflex stent coated with paclitaxel in a slow release of 8.8% formulation triblock copolymer system and pre-mounted on either the monorail or an over-the-wire delivery system. Paclitaxel inhibits vascular smooth muscle cell proliferation and reduces neointimal mass. The local delivery of paclitaxel through a coronary stent has been shown to reduce restenosis rates and percent diameter stenosis, and to produce other angiographic benefits compared with bare metal stents. Thank you.